Hey everybody, this case study is called Fatigued, a Case on Blood. So let's get rocking. Harold is a 67-year-old male who has had regular physical exams, is a non-smoker, and who has been in good health for most of his life. In recent years, he has been experiencing symptoms of heartburn, nausea, and indigestion after eating certain foods. Although he experienced some relief after changing his diet to avoid those foods, the symptoms did not completely subside. Harold was eventually diagnosed with having a form of chronic atrophic gastritis, which is an inflammation of the stomach lining. During Harold's most recent visit to the doctor, he complained that he had become progressively more fatigued at the end of his workday. Difficult tasks would take an enormous amount of effort to complete, while simple tasks would make him dizzy and short of breath. He told his doctor that last month he had a period where he suffered frequent headaches and had difficulty sleeping. In obtaining Harold's vital signs, his doctor noted that Harold was experiencing mild tachycardia, which is an elevated heart rate. His doctor ordered some blood tests, including a complete blood count, a CBC, and a microscopic examination of a peripheral blood smear, the smear on a slide. The notable results from these tests, including the blood smear, are provided below. Harold's blood smear is shown on the left, a normal blood smear is shown on the right. All right, so before we move on, I just want to tell you what I see as I read through this, and then we'll look at all the blood work and answer the questions. So we have an elderly male, has taken good care of himself, but now he's having these symptoms. So when I see heartburn, nausea, indigestion, which you may also hear called dyspepsia, so just improper, abnormal digestion, just problems with digesting at least certain foods. So you certainly are thinking clearly something wrong with the stomach, right? Because heartburn is when stomach contents can leak up into the esophagus. That's why chronic persistent heartburn is called GERD, gastroesophageal reflux disease, because the stomach contents leak up into the esophagus. Nausea and indigestion clearly related. So by avoiding his trigger foods, he did see some improvement, but not completely. So he was diagnosed with a condition called chronic atrophic gastritis. So gastro means stomach, so gastritis would be an inflammatory condition of the stomach. That can be acute or chronic. So I've had acute gastritis, and it was unbelievable. I was, throwing up 3 or 4 times before 10 o'clock in the morning, and you could see that my stomach was being damaged, but that was an acute thing that was dealt with. It was actually caused by a H. pylori or Helicobacter pylori infection. So short-term acute gastritis can certainly lead to problems, but chronic gastritis actually changes the lining of the stomach. So chronic atrophic, trophic means like feeding, growth. It's kind of a, it's a word used all the time, and A means without. So what actually happens, so real simple here, the chronic inflammation of the lining of the stomach actually changes the lining of the stomach, and you're going to get more fibrous or scar tissue. So the absolute simplest way to look at chronic atrophic gastritis is if you have this condition and you're getting older, portions of your stomach are really no longer stomach. They're becoming scar. So this guy's stomach is partially scarred now. Now, the reason I want to pause and talk about that is because when people have heartburn and difficulty digesting, they often think that they have too much stomach acid, right? If you go to the doctor with heartburn, chances are they're going to give you a drug to, hopefully they do counsel you on avoiding trigger foods and not eating too late and not laying down after you eat and all these types of things. But chances are they're going to put you on a proton pump inhibitor or some sort of acid blocking drug, because the assumption is you have too much stomach acid and that's what's causing your heartburn. But I've actually found that in way more than 50% of the time, and actually a lot, some researchers and some clinicians actually say they think it's closer to 80 or 90% of the time. I don't know where the number lies, but in many people, and I would definitely argue more than half of them, heartburn is caused by too little stomach acid, not too much. So let's talk about that. So heartburn is caused by stomach contents getting into the esophagus. It's not caused by too much or too little stomach acid. So those drugs will work. I mean, if you take someone that has high stomach acid and lower it with drugs, then yeah, maybe they'll do better. But if you take someone with low stomach acid, they still may do better, because you're basically shutting off all hydrogen ion production in the stomach or all acid production in the stomach. So they may feel better, but it's because you've removed the acidity of the stomach. So if someone has too much stomach acid production. These drugs can decrease that and hopefully help that person. But we have to ask the question, why do we need stomach acid, right? It's there for a reason. It's important for basically the pre-digestion of food. Like most of your digestion and absorption actually takes place past the stomach in the small intestine. But the stomach acid, its primary job is to denature proteins, to unravel proteins so they can be digested. So your stomach basically takes whatever you're eating and turns it into this syrupy, semi-liquid material called chyme, and it has an important job. So, but stomach acid is also part of your immune system. Because we, especially, ancestral humans used to consume microorganisms with every drink of water, every bite of food. So stomach acid is there to kill microorganisms that are working their way into your body. So I know this needs a little more time because this is a very important point, but how could someone with too little stomach acid have heartburn? Well, the big issue isn't the amount of stomach acid. I hope I've made that clear. It's whether or not it gets into your esophagus. So your stomach could be full to the brim of stomach acid, gastric juice. And as long as that gastroesophageal sphincter stays closed, you're fine. You could have too little stomach acid, but something causes that sphincter to pop open and you're not fine. You're going to have heartburn. So, all right. And that's because it's not an issue of how much stomach acid there is. It's where it is. So here's the link between low stomach acid and heartburn. You actually, if you have low stomach acid, a couple things can happen. Your food's going to take longer to digest. Food's going to have to be in your stomach longer before it moves to the small intestine, and it starts to putrefy. So actually, you're getting food that's putrefying in your stomach, which is leading to gas production. And gas can pop open that gastroesophageal sphincter. If pressure builds up in your stomach because of gas being released by microbes that are putrefying your food, in a sense, that can cause that sphincter to pop open. That's why a very common cause of heartburn and is small intestinal bacterial overgrowth. It's also a very common symptom of SIBO is heartburn, and that's because the gas production in your small intestine works its way into your stomach, and that pressure in your stomach pops that sphincter open. So the key is, how can I keep that sphincter closed? So the reason I like this case study is because of that. This guy can't be making too much stomach acid. Parts of his stomach, the glandular tissue that would lead to acid production, is now a scar. If anything, this guy has too little stomach acid, yet he has heartburn. So don't always assume, and I would say in less than half the time you should assume that if somebody has heartburn, they have too much stomach acid. And there have been studies that have linked, long-term use to these drugs that block stomach acid to problems, because we do need it. So heartburn sucks, I totally get that, but you need to understand why you have it. Even if you look at the physician's desk reference and the pharmacist's red book, basically the Bibles of those two professions, but they actually say that you should not be using PPI drugs. You should not be taking acid-lowering drugs for more than, I believe it's 19 days before seeing a gastroenterologist. So a gastroenterologist, you're supposed to figure out what's wrong with you if you have heartburn, and most people don't. So if you want to know more about that, let me know. I have some information, some resources I can share with you. There's a really good book called Why Stomach Acid is Good for You that really lays that out. Now, I think it can be too biased in the other direction, but don't automatically assume heartburn means too much stomach acid. All right, moving on. We're seeing all these conditions, all of these symptoms. So it's getting harder to perform his daily tasks. He's getting dizzy, short of breath, all these types of things. Tachycardia and elevated heart rate. So it's clear there's something wrong with his blood. So we're going to look at the link between the two. So there's clearly something wrong with his gut. There's clearly something wrong with his blood. So let's see how the two are linked, and we'll see if one is the cause and one is the effect, or if it's something else. All right, so now let's go ahead and take a look. So here we see the peripheral blood smear. So his blood is here on the left-hand side, and this is normal blood cells on the right-hand side. So the first thing you hopefully will notice is that his red blood cells are too large, and we'll explain that with some of the lab values as well. But there are different types of anemia. You can get anemia that causes, that's called microcytic anemia, where your blood cells get too small. This is an example of a macrocytic anemia, where your blood cells are getting too large. And I'll explain, I don't want to give it away yet, but I'll explain why that is. So why he has blood cells that are too large actually ties directly into his condition. And you also should notice there aren't as many red blood cells in this smear. So he has too few red blood cells, and they're way too big. And you may think that if a small red blood cell is good, a large one is better. That is absolutely not the case. All right, so let's see what else we have here. His white blood cell count was at 12.1, which is elevated. So just remember that your white blood cells are a part of your immune system. They play a massive role in the inflammatory response. So we talk all the time about how chronic systemic inflammation is a bad thing, but acute inflammation when needed is a good thing. So anytime your body is inflamed, think it's getting ready to fight pathogens. It's getting ready to fight some sort of invader. Now, if you have an autoimmune disease, sadly, that's inappropriate inflammation. If you have chronic inflammation because of poor diet and poor sleep, et cetera, basically your body is preparing for an invader that's never going to come. So, but this guy Harold actually has an inflammatory condition in his stomach. So don't be surprised that his white blood cell count is elevated. Neutrophils are slightly elevated. So neutrophils are the most common white blood cell we have. They're phagocytes, but they're generally really good at killing off bacteria. So, but it's hard to say if he has a bacterial infection here or not. It's very, very slightly elevated, and his gastritis may or may not be caused by. It may or may not be caused by a bacteria. But you do notice that this is the most significant one. The basophils are off the chart. So normally 0 to 200 per microliter. We're at 1100. So if you don't remember what basophils do, there's a second cell called the mast cell, M-A-S-T cell, that does the same thing. But basophils release histamine and heparin, and histamine is a very pro-inflammatory compound. So when you see basophils, think inflammation. So we know all these things are telling us that he has an inflamed stomach. Well, we know that. He has chronic atrophic gastritis. Then we go to so those are the white blood cells. Then we go to the red blood cells, and we see that the red blood cell count is very low. He should have between 4.7 and 6.1 million red blood cells per microliter of blood. He only has 2.6 million. So especially, if he's a man, I don't know his size, but he probably has half as many red blood cells, or maybe slightly less than that, than he should. So if you have too few red blood cells, we'll see that's going to affect your body's ability to carry oxygen. I think that's pretty clear. So we already know he has anemia, because anemia is, difficulty carrying oxygen and using oxygen. Now we got to find out why. So his hemoglobin is 10.6, below normal as well. So hemoglobin is how well do the red blood cells you do have, how well can they carry oxygen? So not only does he have too few red blood cells, he doesn't have enough hemoglobin either. So hemoglobin, clearly the most important protein in red blood cells. About 95% of the proteins in a red blood cell would be hemoglobin, and hemoglobin's job is to carry iron. Iron's job is to have an affinity for oxygen. Then we have the hematocrit, basically the same thing. If the hemoglobin and hematocrit are both low, they're kind of saying the same thing. So hematocrit is what percent of the blood sample it would be hemoglobin. So that's why they're both going to be low. But notice that he has mean red blood cell volume is actually elevated. So he has too few red blood cells. They're not carrying enough hemoglobin, which means he will have difficulty moving oxygen and using it, or getting it to use it. But the cells he has are too large. That's what tells us he has. So we know he has anemia. That's what tells us he has a macrocytic anemia. So when I was in school, they would have called this mean corpuscular volume, MCV down here. Mean red blood cell volume is perfectly fine. All right, then we have platelets. His platelets are normal. So platelets are pretty interesting. Clearly they play a role in blood clotting, but they actually have found recently that it plays a role in immune function as well. Platelets that are designed or that are going to stick to collagen on a torn blood vessel, for example, to help stop bleeding. They look kind of like a sickled red blood cell in shape, kind of a lip or something. But there are some platelets that are free floating, and they can actually cling. So platelets their job is to get sticky. It's called platelet adhesion. They stick to things. Well, if they're not sticking to a blood vessel wall, they actually can stick to bacteria. So if you're fighting off a bacterial infection, this is relatively new information, that platelets are actually part of your immune system. They will stick to bacteria and then take them to a neutrophil and get eaten. So it's basically they're feeding neutrophils, and the neutrophils' job is to eat bacteria. All right, so hopefully that is a real good introduction to what's going on here. To me, the really, really big thing is you can have heartburn with too little stomach acid. That's just such a common misconception that I want to bring that up again. Okay. Number one, the values collected from a CBC can reveal a great deal of information about a patient's health. This information can be broken down into 3 broad categories, which are listed below. For each of these categories, list all of the CBC values that would provide information on that aspect of the patient's health. So let's go back and look at each. So oxygenation status, looking here, it would not be the first group. Those are white blood cells. It would be red blood cell count, hemoglobin, hematocrit, and mean red blood cell volume. Those 4 tests are the ones that tell us about his body's ability to carry oxygen. That's why we know, because these values don't fall in normal limits, that he has anemia. Now the question is why? There's lots of kinds of anemia. Immune status, signs of infection, allergy, or immune suppression. We go up and look at your white blood cells. So your white blood cell count, neutrophils, and basophils would be the answer there. And then lastly, hemostasis, which is the fancy word for the cessation of bleeding or blood clotting. That would just be your platelets here. Okay, question 2. Review the measurements in the CBC for each abnormal value. Describe what physiological effect it might have on the patient. Connect each of your descriptions to one or more of the symptoms Harold has been experiencing. So this is a really good question because it does ask you to try to correlate the symptoms he's having with the lab values. That's a higher level, real critical thinking. So let's go ahead and look at that. All right. So elevated white blood cell count, slightly elevated neutrophils, and the elevated basophils. All of those, let's scroll back up and look at his symptoms. All of those could be tied into the inflammatory condition that he's having in his stomach because of the chronic atrophic gastritis. Itis means inflammation, right? So he has this chronic inflammatory condition in his stomach. So that's why you're seeing elevated white blood cells, neutrophils, and basophils. So this could, the heartburn, nausea, indigestion, all of those symptoms are going to be tied to really more an effect, right? He's having this chronic inflammatory condition, so you're seeing the really elevated basophils, which actually that accounts for most of why the total white blood cell count is up. So we know he has an inflammatory condition. These white blood cells are telling us that. They're not telling us that he has an infection. So when you think of white blood cells, we often think of infection, but this is clearly an example of this inflammatory condition is what's causing those lab values to be out of whack. All right, next, let's go back. So we covered the white blood cells. Red blood cell count, so he has too few red blood cells. His hemoglobin is low, hematocrit is low. All 3 of those things are telling us he doesn't have enough red blood cells, and the ones he does have are not carrying oxygen well enough. Mean red blood cell volume, same thing. Because the reason a blood cell has to be small, like your red blood cells are tiny. Remember, they don't even have a nucleus anymore. They've had to get so small that they even they shoot out their nucleus, shoot out their organelles. That's why red blood cells have to use glucose for fuel. They don't even have mitochondria anymore. So they were a cell, but a red blood cell is technically not a cell anymore because it doesn't have the DNA that you need to technically be called a cell, right? So we call it a red blood cell, but it really isn't. That's fine. I don't care about that. But they're very, very small. And that's because they need to fit. A red blood cell can be maybe, let's say, 8 micrometers across. It has to fit into capillaries that are half that size. So they have to be really small and really flexible. They also have to fit. It's called a rouleau that forms, but they have to be able to stack on top of each other. So when you think about that, if they're large and not very flexible, like these macrocytic red blood cells are that Harold has, they're not going to do their job very well. So let's go ahead and tie that to some symptoms. So really, we already got all the stomach stuff. So he's getting tired. So the inability to complete his job. He's getting tired at doing tasks he normally could. If something's very hard, it's almost impossible to do. He's getting dizzy and short of breath. He can't move oxygen well enough, so he's getting dizzy because of a lack of oxygen to the brain and shortness of breath. Headaches can be the same thing. A lack of appropriate oxygenation of the brain can lead to headaches. Trouble sleeping. That's because when you're not moving oxygen very well, his body is in a period of stress, right? So he's trying to sleep, but his body is dealing with an emergency, and that's not going to work very well. And then tachycardia. Why would you have an elevated heart rate? Well, if every time your heart beats, it can't move enough oxygen, one of your body's primary responses is to have the heart beat more often. So if you come across somebody that has a really high heart rate, let's say they're in the middle of the woods, you got to be concerned of, are they going into shock? Have they lost a bunch of blood because they're bleeding externally or internally? Or are they going into shock because they're severely dehydrated because of a heat-related illness, right? So if somebody has a really, really rapid, or what they call a rapid thready pulse, you have to consider that they're not moving oxygen well at all, which is why their body's response is, well, if I can't move enough oxygen per beat, I just got to have the heart beat more often. So all those symptoms will be tied. You could pick any one of those to answer this question, but all of those would be tied in there. Okay, number 3. Doctors have determined that Harold is anemic. Describe this condition. What are the primary pieces of evidence from the CBC that point to this diagnosis? So Anemia basically just means, without air, without oxygen. So you're having difficulty moving oxygen. I think we've talked about this, a ton, but let's go back to it anyways. So not enough red blood cells. Even if these were perfect red blood cells, he wouldn't have enough to do the job. Every red blood cell, each individual red blood cell should be able to carry more than 1 billion molecules of oxygen, each one of them, right? And a normal healthy person has 23 to 25 trillion of them. So he's got half as many red blood cells as he needs. He just can't carry enough oxygen. But then he doesn't have enough hemoglobin, which means that even the red blood cells he does have are not going to have enough hemoglobin to properly carry oxygen. And Hematocrit tells you the same thing. And then we know because of the mean red blood cell volume that his red blood cells are too large. So, and the symptoms we just went through it. We need oxygen, right? So imagine someone with anemia, someone with this condition. Imagine like when you're sitting at sea level. To him, it might feel like he's on the top of a mountain. I'm not going to say like Mount Everest, but maybe he's in Denver, or if you ever go to the Black Hills, the difference between Sioux Falls and the Black Hills is actually a few thousand feet. And I know people that go there to cycle that can't believe how tired they get when they're there. They go to a race and can't believe how exhausted they are. Well, so just kind of imagine that. So he's having difficulty getting oxygen like someone that's at a much higher altitude. So if you were to go to Denver today, or if you were to go to, to be somewhere where you were 3,000 feet above sea level, 4,000 feet above sea level, and then you were going to try to do physical tasks, so you might get a headache, you might get dizzy, you might have trouble sleeping if you go to a higher altitude. Now, depending on your level of fitness, you might have to go higher and higher. Some people actually can go to the top of Mount Everest, but they would have all these symptoms. They would be exhausted, they'd have a headache, all these things. So he's starving for oxygen while at rest, the way that someone that's perfectly healthy would be starving for oxygen while they're exercising. All right. Question 3 still. So I think we've been through all the evidence, and that's all. He's a textbook example. That's why we use him as a case study. He's a textbook example of what would happen with anemia. Okay. Number 4, chronic atrophic gastritis is a condition that leads to the degradation of the lining of the stomach. Based on Harold's history of this form of gastritis, his doctor also ordered tests to check the levels of vitamin B12 in his blood. How might Harold's gastritis affect these levels? Let me take a drink here. So when you see someone with anemia and stomach problems, the first thing you should think is B12. And that's because, number 1, B12 gets harder and harder to digest and absorb for everybody. You need a lot of stomach acid to properly digest foods that have B12. B12 is only found in animal products. So you need adequate stomach acid to properly digest and absorb B12 from those types of food. And then number 2, hopefully you guys know that, or will know, that the stomach actually produces something called intrinsic factor that's needed to absorb B12. So you can eat all the B12 you want. If you don't have intrinsic factor, it's not going to be properly digestible and absorbable. So this is why, think about when people get older, vitamin B12 deficiencies are extremely common. And I had a hard time grappling with that until I understood more of these mechanisms, because if you look at the average American eats 200 pounds of meat a year. That's counting meat, right? Animal products is definitely 200 pounds, if not more. So the average American consumes at least 200 pounds of animal products a year. All animal products have B12. That's one thing. Number 2, B12 is the only water-soluble vitamin that we store. You can store. A healthy liver is supposed to be able to store 5 years worth of B12. So we're consuming massive amounts of B12. Most people are. It's supposed to be stored, which means with most water-soluble vitamins, you got to be getting them on a regular basis, because if you don't, they're not stored anywhere. But B12 actually is stored. So you have those two things, and you think then, how in the world would an American have B12 deficiency? Well, it's actually very common. They don't know how common it is, but they think it's way more common than they ever imagined. So I think this is why. I think that we have, Americans have a lot of stomach problems. That could be impairing the production of intrinsic factor. So much so that, as you'll see in this guy's case too, but if an elderly person has a B12 deficiency, you could try to give them B12 supplementation. But if somebody has a B12 deficiency, if they're young and healthy, you might try that. But generally they go right to the B12 injections. So we've gone so far where it's just basically, just forget it. This gut, unless this person was a vegan or something and wasn't supplementing, you could say, forget it. This gut just clearly can't get the B12 out of the food that it needs to. So let's bypass the digestive tract altogether and use injections. You're seeing that now with vitamin D. People with really low vitamin D levels, they're like, man, giving this person vitamin D pills or drops or something is not working. So they're going to intramuscular injections of vitamin D. You can get IV vitamins of all kinds now. But that's a really clear example. So, if someone has digestive problems, think B12 deficiency. That would be an example of a secondary deficiency, because a primary deficiency is you're not eating B12. So unless you don't eat animal products, that shouldn't be an issue in the United States. So it's a secondary deficiency, which means you're eating it, but you're not properly digesting it, absorbing it, storing it, or utilizing it. So there are lots of those that can occur as well. So that's the big key. So maybe he's not properly digesting the food, because remember, part of his stomach is scar now. So maybe he's not properly digesting it. Or number two, it is the lack of intrinsic factor being produced. The cells that produce intrinsic factor are being turned into scars, just like other glandular cells in the stomach. Okay, number 5. Excuse me. There are many different types of anemia. Which specific type of anemia is Harold suffering from? Beginning with the peripheral blood smear, describe the key pieces of evidence you use to draw this conclusion. So let's scroll back up and look at that. So we've already covered the CBC plenty. But remember, he has a macrocytic anemia. So if his red blood cells were too small and real pale looking, the first thing I would think is microcytic anemia, and I would think iron deficiency, right? Iron deficiency anemia is the most common one worldwide. Iron deficiency is the most common mineral deficiency worldwide, because most people don't eat iron-containing red meat, etc. So we know that he shouldn't have an iron deficiency. When you see, and there are lots of types of anemia, right? We're just talking about the real big ones. I always think iron, B12, and folate are the 3 big ones. So when you see these large red blood cells or macrocytic anemia, I now have it narrowed down to a B12 deficiency anemia or a folate deficiency anemia. And one can actually mask the effects of the other. So if somebody has a condition where they have a macrocytic anemia, I generally recommend getting them both B12 and folate. Generally can't hurt. Giving somebody, or even if they don't have anemia, right, and someone needs B12 for some other reason or needs folate for some other reason, I generally recommend giving them more of both, because you don't want a whole bunch of one of those 2 B vitamins. Folate's also a B vitamin. You don't want one of them masking the effects of a deficiency of the other. And that can happen. I had a patient that was using folate years ago, and they had terrible sciatica. They'd been to multiple doctors and couldn't figure it out. So I basically said, I'm not going to keep doing the same things to you, because they're clearly not working, so we're going to try something different. So I did a more detailed lab analysis and found that they had a B12 deficiency. B12 is critically important to nerve function. So this person's sciatica was not caused by an autoimmune condition, is not caused by a musculoskeletal condition. It was a B12 deficiency. So just fixing that with B12 injections was able to completely eliminate the problem. So we have, it's either B12 or folate, but it's pretty clear now you don't need intrinsic factor for folate, and we can absorb folate a lot easier if you get it from the right foods, right? So it's pretty clear this person's problem, Harold's problem, is a B12 deficiency based on his stomach. So when I mentioned earlier cause versus effect, his stomach problems have led to this anemia. If he had chronic atrophic gastritis, but it was getting a B12 injection every month, he wouldn't have developed this condition. So all signs point to B12 deficiency for that reason. But could it be folate? I mean, absolutely. I've been fooled before. So that's why I would probably use B12 injections, but also a B complex that would cover his need for folate. And notice I'm saying folate. This is not the scope of this case study, but folic acid is not near as good as folate. You want folate is what's in food. Folic acid is made in the laboratory. And you guys know how I feel about the two. When in doubt, go more natural, right? The way that humans have gotten folate. So if you're going to take folate supplements because you're pregnant or you have elevated homocysteine levels, need to bring them down, or you want energy, whatever, try to get food-grade folate. Very, very important to me. I won't go into the details of why now, but you can certainly ask me. You can ask and comment in the video, or you can email me, whatever. Just ask in class. All right. So we talked about number 5. Number 6, what would the treatment for Harold's blood condition be? Explain how this would help treat his symptoms. So, I mean, of course, whatever you can do to help his stomach would be great, but just saying, hey, eat some more meat doesn't make any sense. He's got a stomach that won't properly break it down and digest it. He's got a stomach that, so it won't allow B12 to be absorbed very well anyways. He's got a stomach that probably isn't producing near enough intrinsic factor to even do it. So B12 injections would be the answer here. You could certainly, you could certainly try a B12 supplementation and see how much that would help, but I generally would go, they're cheap. I think they're, $10. So, and I think that's if you pay cash for them. So they're cheap. they are way more effective to put the B12 right into your bloodstream. So that's what I would do. How would this help treat symptoms? We haven't talked about that. That's actually a really big point. Why does B12, I'm going back up here to the blood smear, why does a B12 deficiency or a folate deficiency lead to this? Why does it lead to these huge red blood cells? Well, when you think B vitamins, you should think energy. But B12 and folate are way different than that, right? The rest of the B vitamins, they play a critical role in your metabolism. B12 and folate does as well. But when I think B12 and folate, I think cell division. B12 first, then I think energy. With the other B vitamins, it's all pantothenic acid, whatever, niacin. I'm thinking energy first and then other things. So B12 and folate they're needed for the production of DNA replication, right? One cell can't divide into two unless one pile of DNA divides into two. So B12 and folate are both needed for DNA replication and cell division. So what's happening here? So you see these really big red blood cells. Why are they so big? They're supposed to be two. They're supposed to be two red blood cells. So without the appropriate amount of B12, or in this condition, or folate, and someone had a folate deficiency, these cells won't divide. So that's why he has macrocytic anemia. He has one large red blood cell where there should be two. And if you look at his red blood cell count, it's actually half of normal, right? So he's got half as many red blood cells, but they were supposed to double. They were supposed to divide. And if you think about it, if his red blood cell count doubled, he would be at 5.4 million, which would be completely normal. So that's the big thing. His cells are not properly dividing. Like if you have iron deficiency anemia, your red blood cells might be perfect. They just don't have enough iron to carry oxygen. So there's that. What else about that? So folate, just as an aside here, the first chemotherapeutic drugs, they were designed to block folate. So blocking folate can actually be used to fight cancer, because chemotherapy is all about, let's stop the rapidly dividing cells from dividing. So if you can remove folate from the equation, it will slow cell division. So of course, chemotherapy hurts your cells too. Your cells need to divide as well. But the hope is if you block some pathway that affects a rapidly dividing cell more than a regular cell, that's how chemotherapeutic drugs work. So, all right, so that's actually a really important point. Hopefully you've listened to this long enough to get to that point to answer that question. All right, so we talked, so that's why B12 would help him. His cells would start dividing normally. His red blood cells would start dividing normally. He'd have twice as many red blood cells that were functioning properly, and he should be fine. All right, last question, number 7. Harold's tachycardia, and if you don't remember, tachy means fast, so it's his elevated heart rate. So his tachycardia and chronic gastritis are key pieces of evidence in this case that go beyond what shows up in his CBC, his complete blood count. One is the cause of his condition, and one is a result or sign. Now, just real quickly, the word sign. Sign is something you can objectively measure. A sign is something you as a clinician can see. A symptom is something that the patient tells you. So symptoms are subjective, signs are objective. All right, identify what is the sign and which is the cause, and describe the relationships to his condition. So the sign, the problem that's being treated when Harold goes to the doctor is the anemia. The fatigue, exhaustion, dizziness, elevated heart rate, et cetera, right? All these things. Some of those are subjective, some would be objective. So some would be symptoms, some would be signs. But that's the problem. But his problem isn't his blood cells, right? His blood cells can divide normally if they have enough B12. His blood can function normally if he has enough B12. So the actual cause is the chronic atrophic gastritis. As his stomach is slowly turning into a scar, he is not properly able to digest food and extract B12 from it. So if you're looking at cause and effect, the cause is the chronic atrophic gastritis. The effect is the anemia. Now, what caused the chronic atrophic gastritis? I mean, just getting old. Getting old is a disease, right? I mean, that's the way I look at it. Getting old is going to lead to some of these problems. But certainly if he ate better and was more hydrated and did all these types of things, if he could do things to improve his stomach health, that would certainly have gone a long way to help slow this process or completely eliminate it. But it's too late for that. So now he has this chronic, inflamed, scarred up stomach. You certainly want to deal with that in any way you can. But that is the underlying cause, right? So you don't, other than B12, there's nothing that needs to be done to fix this guy's blood, to fix Harold's blood. You got to fix his stomach and or find a better way to get B12 in his body, and he should be completely fine. Now, if we were surprised that didn't work, that's when I would go to folate. I would say, okay, all signs pointed to B12 deficiency, but it actually was a folate problem. So, all right, I hope this helped you guys so much. I hope you can start to put these pieces together. It's so important to me that you guys don't just do rote memorization and just memorize stuff and forget it. That's a terrible, terrible strategy. So I hope that using case studies like this really helps you put things together
And you reach out to me if you need anything, okay? I am here to help. All right. Have a wonderful day.